In India, the oldest system of medicine is Ayurveda. 16th to 18th century, in India, we got the English medicine system. Under the government of India, we have 3-tier system of healthcare. What are those? Hello my dear students, I am Ajay sir, faculty Department of Commerce and Management, Vidyashram First Aid College, Mysuru, a temple of excellence. My dear students, in today's session, I am going to handle the subject Management of Service for 2nd Sem BBA, and the topic is Hospital and Education Service. Now let's go to the first slide, Evolution of Hospital Sector or Evolution of Hospital Service or Medical Service in India. See, you all know that and we all know that in India, the oldest system of medicine is Ayurveda. So, oldest system of medicine is Ayurveda, which is built in 1000 AD only. In ancient Ramayana and Mahabharata time only, we were having Ayurvedic medicine using plants and herbal treatment. We were doing the operation also. We were conducting operations with the help of Ayurveda and with the help of the plants and herbal medicines. We were using so much advanced technology in the Ayurveda during the Mahabharata and Ramayana time only. And also Charaka Sushruta Samhita, the book written by Charaka Maharshi, has given so many information regarding the how to use the medicinal plants, how to treat our diseases and how to take care of the diseased person, and also conducting so many operations using the herbal and plants. So, in India, hospitals have existed from ancient times. Hospitals were existed from ancient time only. During Mahabharata and Ramayana time only, we were having so many surgical operations were also conducted by using herbals and plant medicines. In 6th century before Christ only, during the time of Buddha, there was a number of hospitals to look after the handicapped and poor people. So during the time of Buddha only, we were having hospitals which take care of poor people and also handicapped. Next one, the outstanding hospitals in India at the time were those built by Ashoka Chakravarti. The Ashoka Chakravarti, during his time, we were having a wonderful hospitals in India which was providing healthcare facility by using the Ayurvedic and herbal medicines. During the time of 273 and 232 before Christ only. The next one, book written by Arabian and Europeans travelers around 600 AD also given the information, proof regarding there was a wonderful system of health and also medicine were available in India. So we as Indians only don't know about our importance of our system, our Indian medicines. But even though Arabians and Europeans were knowing about our Indian medicine system. So because of these resource only Indian plants were very, very important in order to provide the medicinal facility or medicinal treatment to cure the diseases by using the Ayurveda and also so many other herbal medicinal techniques. So next one, the invasion of foreigners in the 10th century AD brought with them their own physicians called Hakims. So the invasion of the Arabians and Central Asia, those king who attacked India, and also they introduced their culture and also medicinal techniques in India. They brought the physicians called Hakims. So these are all the doctors or physicians who take care of or who are providing the medicinal service and also conducting some surgical operations. They were called as Hakims. So these systems come from the Central Asia. The use of allopathic system of medicine commenced in the 16th century with the arrival of Europeans missionaries. So when Britishers acquired India or occupied India, so because during their time 16th to 18th century in India, we got the English medicine system called allopathic medicine system. And also from the missionaries who were established in India, European missionaries established in India, they built so many hospitals and also they started to develop English medicine system or allopathic medicine system in India. Next one, it was during the British rule that there was a progress in construction of hospitals. Organized medical training was started in India in 19th century. So it started from 16th century. So during the English and so many travelers from Europe, it may be French, Dutch and Britishers who arrive in India, and also they started some Christian missionaries, and also those missionaries were also providing health sectors, and they introduced the allopathic medicinal system in India, which is very popular today nowadays. And also during the 19th century, when India was under British rule, the British introduced and constructed so many advanced technological and equipped hospitals in India, which were providing the health service in India. Next one. So Indian public health system. What do you mean Indian public health system? So under the government. So how the health system is divided on regional level, state level and national level. What are the systems and what system the government is taking care of the public sector? Let's see here. So we have three type system of health care service in India. Under the government of India, we have three tier system of healthcare. What are those? First one, primary health system. So which is established, primary hospitals established. So for example, they will be not having any bed facility. You cannot admit the patient there. They only provide the clinical service which is established in rural area or urban area. Even in urban area, every town or every locality will be having a primary health center. So you might have observed, if you go to corona vaccination, you might have seen the primary health sector from government of Karnataka. So this comes under state governments. Those primary healthcare unit will be organized and maintained by the state government. Next one, secondary health service. This is on taluka level, and some town level will be having secondary health system. So they will be having 10 to 20 beds available to admit the patient, and also they will provide the clinical service. Outpatient service also available, and also they will admit the patients and provide the service. But they will be not having advanced technology like operation theaters and all. They will be not having, but they will provide some 1 or 2 days service for the patients. Tertiary means some advanced technology. With advanced technology, they will be having operation theaters, X-ray facilities, and also some other medicinal equipments, operation equipments were available, and other treatment facility are also available in tertiary hospitals. It is on district level. So district medical hospitals, you might have seen every district there will be district hospitals. These are tertiary. So primary is under locality, maybe 2-3 villages. For every two to three villages we will be having one hospitals, and also in town, every town sector, for every locality will be having primary health sector. Next one, secondary means on taluka level, on town level we will be having a secondary health hospitals. Next one, tertiary means on district level. So for every district we will be having some hospitals, and also the central government also providing some health facilities. For example, apart from district hospitals, we have some specialized hospitals. For example, we'll be having Jaydeva health sector or Jaydeva hospitals in India, which is specialized in the heart diseases like that, and also eye care hospitals will be having at district level. So these are all tertiary hospitals, which is specialized hospitals for providing special diseases. Next one, public sector ownership is divided between central state government and municipals and panchayat, also local government. Municipal and panchayat government. Municipal means in the city area and town area, that comes under municipal area. Next one, panchayat is and rural area, we will call it as panchayat area. So and also state government, so district hospitals and other hospitals comes under states government. For example, if you go to the some specialized hospitals comes under central government. So specialized hospitals like cancer hospitals, or it may be heart disease hospital, eye hospitals. These specialty hospitals comes under central government, and regular hospitals comes under state government. Next one, the facility includes teaching hospitals. So for example, nursing hospitals, teaching hospitals. For example, Mysore Medical Hospital, they also provide the training also, at the same time hospital facility also. Next one, secondary level hospitals. Secondary levels means taluka level hospitals. Next one, first level or primary hospitals under rural level and locality level will be having primary sectors hospitals, and also community health care. So in the rural level only we will be having community health care. For example, in forest area we cannot develop any big hospitals, there we will be having community health care, and also rural hospitals. So for example, for all the in a town including 10 to 15 villages will be having rural hospitals. Next one, dispensaries and also primary health centers, sub-centers. So sub-towns or sub-level towns will be having a sub-centers, and also health posts. Health posts are available. For example, in case of corona, we will be having health post. So it may be just, it's like a camp. So for eye camp, they will organize, and also blood camp they will organize. Like this, they will be having health post. Next one also includes the public facilities for selected occupational groups like organized workers. Now, for example, defense hospitals we are having, ESI hospitals we are having, railway hospitals. So all the workers, their own organization has developed some hospitals facility for the benefit of the workers. The employer of the institution, for example, government is the employer of the railway, so they will provide the hospital facility for all the workers, comes under railway sector. Next one, ESI hospitals, who are all paying the ESI, overall comes under ESI benefit, they will go for, they will be having ESI hospitals. And also we have Ayurvedic hospitals, we have homeopathy hospitals, we have other hospitals available among the government sectors under different schemes. Next one, the private sector also. In today scenario, the private sector hospitals are very, very important, because the government cannot provide the health facility for all the population in the country. So because our health system, we know the health system in our country, so it is not up to the mark. Even the government, or it may be government or private, because of our population, so we have very lesser number of doctors and also lesser number of hospitals compared to our, there is a equation between doctors and patients, so we cannot match the equation compared to other developed and developing country. In India, the number of doctors are very, very less compared to our population, and also because we only got the we have seen everything during the corona time only. So because of when there is a corona, it was peak, we were having shortage of hospitals, shortage of beds, shortage of doctors, or this is the regular problem in India, day-to-day problem in India. So that's why we need private sector also. But if you compare today's scenario, if you examine today's scenario, even private sectors could not support or could not provide enough doctors, enough beds and enough facility for the population compared to our population. So since we are having very huge population, our health sector is very, very small to our population. So our health sector is not much efficient or much effective to take care of the Indian population. So we need so much hospitals from government sector also, and also from private sector also. For example, for every 100 patients, we have one doctor. But in India, up to for every 20 to 30,000 patients, we have one doctor. So this is the scenario, or this is the condition in Indian economy or Indian hospital sectors. For every 100 to 200 patients, we have one doctor, according to the actual equation. But what is happening in India? So in India, we up to for every 20,000 to 25,000 or 30,000 patients, we are having one doctor. And also we have some equation, for every this much of patients or this much of population, we should have 100 or 200 beds. In that also we could not match to the actual equation or standard equation available in the provided by the World Health Organization. So because of so many problems, because of lack of resource is the main problems in India. Lack of doctors, lack of experienced and educated doctors, and also lack of medical colleges. So we are not having enough medical colleges. We cannot produce enough doctors if we don't have enough medical colleges. So these are very important problems we are facing in our country. So we need both private sector also. Only public sector, through using public sector we cannot offer better and cheap health facility or better and affordable health facility to entire population. The government will take care the poor people, and also we need private sector hospitals who wants advanced health facility. Next one, these are also dominant sectors and service ranging from 1000 beds to 2 beds facility. What do you mean by that? See, more than 1000 beds facilities are available in the private sector, and also for every patient they provide 2 beds, because someone will be there to take care of the patient's family members. If you go to the special wards, you can find 2 beds. So there, 1 bed for patient, another bed for the person who take care of the patient's family member of the patient. So they are providing the 2 bed facility also. Next one, hospitals and institutions that built, staffed and equipped for the diagnosis of diseases. So what is the nature? What are the nature of health sectors? So hospitals are built. So we have a building, we should have a proper building which is equipped with all facilities. It may be water, or it may be bed, or it may be fan, AC, operation theater, blood bank, and also other diagnosis centers, and also X-ray unit we need to know, MRI scanning unit. So all types of facility we need, and also other facilities, cooking facility we need, and also washing facility we need, or understanding. So we need, it is a huge investment. Hospital is not ordinary thing to build. So it is a huge investment, and also all diseases, and also we should have specialized doctors and specialized facility and equipments and operation theaters to run the hospitals for the treatment, both for medical and surgical. So not only providing the treatment or not only providing the medicines, and also we have to perform surgical activity, so that we have to or we need enough materials, enough resource, enough all facility to conduct the surgery. So even a shortage of any one thing or any one facility, so we cannot perform the operation, surgery, isn't it? So if we don't have the oxygen facility, during the corona time, what is since there is a shortage of oxygen, so many patients died, isn't it? So everything is very important. So we need X-ray unit, we need MRI scanning unit, we need other scanning facility, diagnosis facility we need, and also we need the proper oxygen facility should be there in the hospitals, proper staff should be there, proper highly educated, highly experienced and highly trained staffs we need to conduct or to perform all the duties in the hospitals. We need nurse, doctors, other office and other surgical staffs we need for the sick and injured person. And also we have to need emergency unit, we need blood bank, we need OPD. So all the facilities we need to establish in hospitals. Next one, and their housing during this process, and also we have to provide the food and shelter for the employees and staffs in order to take care of the employees. Next one, the modern hospitals also often serves as a center of investigation and teaching. In today's hospitals, they are also conducting research activities. For example, research on corona. So what are the mutants of corona, and they are conducting so many research, and also they were providing the education. So house nursing homes are those which provides the training also, education also, and they are also building doctors, not only providing the health service, they are also providing the education to build the new doctors for future generation. Next one, hospitals management policy should emphasize the hospitals buildings with the earthquake proof, flood proof and fire protection features. So while building a hospital's building, so we should have earthquake proof building we should have, because so many patients are taking care. We are taking care so many patients in the building. So even a small mistake or even a small fault may leads to death of the patient. It leads to huge cost for the family of the patient. So every small facility also needed, very important. In the small points are also very important in case of hospitals. It is not ordinary buildings. So there are so many doctors are available in the hospitals. There will be so many doctors, patients, family members of the patients and others no staffs are available in the hospitals. So we have to take care of all the peoples. So that's why we have to provide earthquake proof facility, earthquake proof building we need, and also flood proof. So if in case any natural calamities happen, they have to having a flood proof in the building, and also we have to construct the building in order it should not affect with the flood. Next one, eco-friendly. So hospital should be having eco-friendly, and eco-friendly means it should be environmentally friendly. Situation should be there. Should be a garden should be there. So we should have enough trees in the hospital campus so that patients should feel happy, they should feel calm, and also while providing the service, doctors are they will be having so much tension on they will be workaholic, isn't it? They will be workaholic because they have to take care of the patient. They will be having so much tension during their duty to perform their duty. So we have to provide eco-friendly environment in the hospital's building, and also surrounding of the hospital should be eco-friendly, and also so this should be friendly for the handicapped and also other patients also. For example, we should have a lift facility in the hospital's building so that handicaps also can walk or can come and go to the hospitals. Next one, outdoor patients department. What is the outdoor patient department? So it is a department which shall plan keeping in mind the maximum peak hour patient load and shall have a scope for future expansion. Indoor patients are those which are already admitted in the hospitals and taking the medicines or taking the facility from the hospitals. Outdoor patients means these are the patients who come for regular checkup and any other new checkup someone will be coming before getting admitted to the hospitals. So these are all comes under OPD. So for OPD we should have all the surgeons or specialized doctors to take care of that particular patients. Next one, reception and inquiry. May I help desk. So we should have, so whenever you visit the hospital, the first person you meet is the receptionist. You have to take the appointment with the doctor, and also we need information regarding the availability of the bed, and also what are the charges charged by the hospitals, and what are the expenses the patient has to bear, and how to know what is the payment mode, and how to get the bed facility, what are the procedures, and how to meet the doctors and where to meet the doctor. These are all the information given by the receptionist. So that we need reception facility. So be available with the complete staff fluent with local language. So we should have the receptionist should be having a local, it should be expert in the local language, because even though we need English, but also there should be local language, because most of the patients are coming from regional area, rural area. They should be able to communicate with and also give information to the local people. So usually hospitals deals with most of the people visit to the hospitals are local people. So they have to regularly they have to deal with the local people, so that they should be experts in the local language. Next one, waiting space. So before meeting doctor, so some patients has to wait, because doctor will be busy in taking the information or consulting other patients. So till that consultancy end, till our term comes, so we have to wait. We have to wait for the treatment in the hospital. So we need waiting areas. It should be enough large, because for example now corona only we are having disease which will spread in the closed area. So a waiting area should be open area, and also there should be enough light and air facility should be there in waiting area, and also it should be big enough to accommodate all the peoples with minimum space. Next one, clinics. So what do you mean by clinics? So in hospitals only they will be having small clinics which will provide the specialized services. The clinic should include general, medical, surgical, ophthalmic, ENT, dental and other facilities also, and also gynecology, and also post-mortem unit, and also pediatrist and dermatology and physicist. We need all the facilities in the hospitals. So we need in the clinic means it is a small department. So for example, there should be a ENT doctor should be there, and also surgical unit should be there. Next one, medical unit should be there, and also general unit should be there, and also we should have a blood bank facility also should be there, and also gynecology should be there, and also neurologist, and also orthopedic. Every doctor should be there. So every doctor will be having a small room that is called clinic. So if you go to big hospitals, for every doctors, for every specialized doctors, we will be having, gastroenterologist will be having separate unit, and also gynecologist will be having separate unit. OPD will be having separate, general doctors will be having separate unit. So if you go to doctors, you may see, so many rooms will be there. For every, in front of every room there will be boards also available. So which doctors and which type of disease he will treat. So all the facilities should be available. Next one, nursing service. So hospitals also providing nursing facilities. So various clinics under ambulatory care area requires a nursing facilities in common with, which include dressing room, and also site, laboratory and injection room, social service and treatment room, etc. So in the nursing care also they have to provide the dressing room should be available, and also injection room should be available, and also social service rooms also available. Those duties performed by nurses, so they have to provide the minimum facilities to take care of the nurses also. Next one, emergency department. So these are all the department which will be having specialist or specialist doctors to take care of the emergency units and emergency patients. For example, accidents and other emergency problems they have to take care. Next one, it is a medical treatment facility specializing in emergency medicines, the acute care of patients who present without prior appointment. So here, for example, accidents happens to any patients, so without any appointment they have to take care of they have to attend that particular person because he is in emergencies. So emergency means the person is in, we have to give immediate care. Immediate care is available, or immediate care should be provided to that particular patient because he is in immediate need. So that's why we should be having ambulance, and also we should having all facility to take that patients to the operation room. We have to conduct immediate operation to that particular patient. So we need immediate surgeons. So we need immediate, everything should be, first before only everything should be ready. So it should be precautionary measures should be taken in the hospital, so whenever the patients arrive because of accident or because of emergency, emergency service, so they have to provide emergency service with emergency doctors, nurses, everything should be ready. Next one, either by their own means or by the means of ambulance. So emergency patients may come through their own transportation facility or through ambulance. So we have to be ready before patient coming to the hospitals. We should be having blood bank should be available. In blood bank, all types of blood should be available before attending emergency patients. And also in reception, they have to sometimes so many times for an emergency there will be no family members to pay the money, but in that case also first the hospitals has to provide treat the patients and also conduct the operation, and all later they can inform to the family members. So the emergency department is usually found in the hospitals or other primary center areas. Intensive care medicine unit, so into ICU. So ICU is a unit which provides the intensive care. So critical care unit, which is also called as critical care unit. So CCU also is available because we have to take extra care of the patients. So it is not ordinary regular patients who are suffering ordinary diseases. So those who are having a extra care or extra problem, we have to take care of them. So it is a medical specialty that deals with seriously or critically ill patients. So those patients who are serious, so who need immediate attention. So we need those patients who needs immediate attention should be kept in extra care unit or critical care unit. Next one, blood bank. So every hospital should be having a blood bank with all types of bloods are available, and also even though sometimes outdoor patients will come for blood, and also they have to provide blood for indoor patients. So we need, the hospital should take care the adequate supply of blood, and also they have to receive the blood from healthy person, and also they have to provide the blood, and also that should be gone through many process. Later it has to be go to other patients. That's why we need blood bank facility with enough blood in the hospitals. Next one, mortuary. So mortuary is a room where dead bodies are stored. So till for example, the person who died because of accidents, the family members doesn't know about the incident. So till the family members take the body, the hospitals has to secure the body with proper facility. So that we need mortuary service also. So in hospitals where dead bodies are kept, you can also use the word mortuary to talk about the funeral homes. Next one, they have in hospitals also they have to conduct the post-mortem. So in order to conduct the post-mortem, or after conducting the post-mortem, we need the mortuary facility to store or to keep the dead bodies. Next one, other facilities. So short-term hospitalization. So hospitalization means, for example, in 1 day or 2 days we have to admit the hospital's patients. Next one, emergency room service. So we need emergency room service, for example, critical care service, or also next one, general and specialty surgical services. For example, eye care unit, or also heart disease unit, or other unit which is specialized. Next one, X-ray or radiology service, and also laboratory service and blood bank service should be provided to the hospitals. These are all the facilities and natures of the hospitals. Next one, healthcare workers safety. So here, doing work in or performing duty in hospitals is not ordinary job. So we have to take, for example, corona only, so many doctors died because of corona infection. So we have to provide health, because when the doctor is healthy, he can provide health facility to others. When nurse are healthy, she can provide the health facility, or she can take care of others. So we have to provide the first or very precautionary service or precautionary benefits to the first level, or precautionary care should be given to the healthcare workers. So that's why they are called as corona warriors by the government of India. They are warriors. They are the first level workers in order to give the health facility to the country. So they are the people who providing the health facility to the country. If in case they only sick, how they can perform their duty. So if the health sector itself is sick, the others also will become sick. That's why we should take extra care for the health workers, or it may be health workers include surgeons, doctors, all the employees or all the workers who are doing their duty in the hospitals, all consider health workers. So we have to provide safety measures and safety equipments in order to secure themselves from disease or infections. That's why provision of protective gloves, gears and all like gloves, masks, gowns, caps, personal protective equipment, PPE kits, and also all the facility should be given. For example, PPE kit, they need PPE kit to protect themselves from the infection. They need gloves, they need mask, they need all the other facilities in order to, and also sanitization of hospitals, keeping the clean hospital area, maintenance of hospitals. So everything is needed to protect the doctors, protect the nurses, and protect all employees in the hospitals. Next one, promotion of hand hygiene. So hand hygiene, not only hand hygiene also includes, we have to wash the toilets in hospitals. The toilet maintenance should be there, and also floor maintenance should be there, and also because it is whenever infection can possible, because it is a very critical, all types of disease persons are coming and going from the hospitals, isn't it? So there are so many chances. So there are n number of chances are there for the infection for doctors and nurses. So we have to provide the hygiene facility. It may be hygiene in providing of food, hygiene, and also uniforms, while providing the uniforms, and also washing of uniform should be very much hygiene. Next one, also they should display the standard operation procedure. So they have to train all the nurses, doctors to provide the standard operating procedure. So everything should be standard, everything should be hygiene, everything should be clean. Next one, implementation of infection control practices and BMW management. BMW management means no, taking care of the and maintaining the floor area and maintaining the hygiene, and also implementation of infection control using the infection control sprays in the hospitals. Everything should be sanitized for every now and then. The floor has to be clean, and also with using the proper sanitization, and all the doors, and also no other no handling door handlings, other no, wherever the hospitals or rush is more, always we have to provide the no infection disease or infection control, no measures should be taken. Next one, regular training to health workers. So we have to provide to, in order to keep them encouraged, keep them no take care of the employees, take care of the workers. We have to provide the regular training to all staffs in the hospitals. So in the next session, we will discuss in the risk involved in the healthcare sector and also marketing of medical care service. These are all things we will discuss in the next session. Till then, thank you so much. See you in the next class.